Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning is on mental health. May is National Mental Health Month, which was established in 1949 to increase awareness of the importance of mental health and wellness in the lives of Americans and to celebrate recovery from mental illness. My first guest has worked extensively in the field of mental health. Martina Gollin-Graves is the president and CEO at Mental Health America of Wisconsin, and her work is driven by the organization's commitment to promoting mental health as a critical part of overall wellness. How are you, Martina?
I'm well, Andrea. Thanks for having me.
Well, it's good to see you. It's been a while. And of course, this is a great time for us to get together and have a conversation that is much needed during this time. As I mentioned, May is Mental Health Awareness Month, and you say that Milwaukee is facing an unprecedented challenge to preserve and protect the mental health and well-being of our community's children and families. So talk about the importance of not only being aware of our mental health, but also being comfortable enough to talk about it.
That's a great place to start, Andrea. I think the pandemic has really unearthed a lot of mental health situations in our community, some that were already there and some that have just been heightened. And so certainly folks who have a history of mental health issues certainly need care and support. But what we're starting to see is that there's this subgroup of folks who maybe never had mental health issues before that really are kind of rising to the top of our concern. And so we just put out a press release really wanting to bring attention to the community about children in particular who have been isolated from school and other natural supports and their families, and bring the community together, to create a roadmap to support our children and families as we move into the summer and then back into the fall when they go back to school.
Yeah, and that's all very important information, and we will definitely get more into the aspect of children and mental health. But for many years, talking about mental illness was considered taboo by our society. Nobody actually said it was taboo, but it was very clear that nobody really was talking about it. So in your opinion, why was there always shame attached to this subject when there are millions of people who struggle on so many different levels every single day?
You know, unfortunately, our healthcare system has done a wonderful job of screening for many physical health related illnesses, but we look at our brain and our mental wellness separately and very differently than we do our physical health. And so as time has gone on, we've really isolated and labeled any conditions that are related to mental wellness and the brain, and that has increased stigma. So our community has gotten very good about prevention for physical health and wellness, but we're really struggling to get to the same parity as we are with our physical health and mental health.
Yeah, so needless to say, COVID-19 impacted people on so many different levels, resulting in social isolation. There was an economic downturn for many people, job loss, and not to mention witnessing the racial and socioeconomic disparities on so many different levels as well. A lot to digest, needless to say. So how has your organization responded to this public health crisis?
You know, unfortunately, the pandemic has revealed disparities that were already very prevalent in our community, especially in communities of color. And so, as you can imagine, in the same way that the pandemic soared and ripped through communities of color in terms of COVID-related illnesses and deaths, it also unearthed mental health issues. And so when I talk about our crises in our community, I am talking about children, families, and communities of color. Unfortunately, the disparities that were already there have been unearthed and risen to the top in a magnitude.
And so, how do you begin to deal with those now that they are right there for everyone to see?
So we have been very fortunate. We have received funding from the Department of Health Services, from Herb Kohl's Foundation, for us to be able to better respond to the increased referrals. We are seeing increased referrals, probably about 33% increase in referrals since January of 2021 to date. And so we have been fortunate to have extra funding. And so we provide through this funding, we're able to provide therapy sessions free at no cost to healthcare workers and other essential workers, as well as to children and teens who are in need.
Okay, that's good to know. So, you did mention that there is this subgroup that may have never really dealt with any type of mental health issues. And when we say mental health, I mean, that can be as simple as stress. And stress does a lot of things to not only our minds, but to our bodies. And so, adults are not the only ones suffering. And when you think about, paying bills, when you've lost a job or trying to pay your mortgage and put food on the table, the level of stress that goes along with that, some people can't even imagine what it feels like. So then you have children who are in that same household who, like you mentioned, are no longer in school. They are right there at home with whatever's going on right there surrounding them. So the focus might be a little off. Some kids may have done better at home, but certainly there's a large number of children who suffered being away from the classroom. And then also you have the impact of not being able to be around their friends, the change in routine, the list goes on and on. So when we talk about children, how does someone watching who probably notices something different about their child, whether it's a small child or a teenager or young adult, what do you think they should do? And how do they recognize if something has shifted with that young person?
That's a great question. And I think, some symptoms are really obvious, right? So it might be increased isolation, if there is such a thing in the middle of a pandemic, but not connecting with others, certainly eating less or more, sleeping less or more, but even just not having the motivation to participate in school or complete their schoolwork. Some of those more subtle nuances, especially if you had a student who was generally a good student prior. What I like to tell parents is what I like to tell parents is that they are the experts of their children. And if their gut tells them that something is different or something is wrong, pay attention to it. And not everyone wants to start out with therapy and a psychiatrist. I get it. We don't want to label our children. Your pediatrician is an excellent resource to kind of run by your pediatrician some of the things that you're noticing, some of the changes, and then get a referral or support from them. But start with your pediatrician.
Okay. And also, they have your organization where they can make a phone call and ask for resources, where to turn to if they're seeing one thing versus another, because also dealing with the umbrella of mental health is suicide. And it has remained the second highest leading cause of death for children between the ages of 10 and young adults to 24 years of age. So, a lot of times I've had parents on this show talking about the fact that they really didn't see suicide coming.
Unfortunately, that's very a familiar story. And I encourage people to not wait. And so because suicide is so prevalent in our community and across our state, it doesn't just start with suicidal ideation. Anxiety, increased anxiety or depression are very serious, but they're also very treatable. And so I think a lot of times parents and adults alike that we wait until we're at the crisis stage. And so I encourage adults and children alike, if you're not sure what's going on, reach out to an organization like Mental Health America go online. We have a screening tool, an online screening tool. We'll ask you just a few questions to maybe help you frame what your experience or feeling for both adults and adolescents. And if you want to just talk to someone, call MHA Wisconsin. We also have an outpatient clinic for adults, adolescents, and children. There are lots of resources in the community. So if you're not sure and you're worried, do an online screening or just reach out to a professional and just talk it through. It doesn't mean that you have to engage in therapy right away, but it certainly is helpful. I just want to mention that for suicide prevention and for adolescents, we just started a new program for LGBTQ youth, starting at the ages of 13 through 24. And so we have a warm line, and people can find that number on our website. But it's peers who are young adults themselves who have lived experience with mental health issues or substance abuse issues. And if people just want to talk, kids want to talk to someone who kind of gets it and understands, that's a resource.
Yeah, I love that. This is a great time for you to give out your website address as well, please.
Yeah, thank you. So if people want to call the office, it's 414-276-3122, and you can actually talk to a real live person between 9 and 5. But also, if other folks just aren't as comfortable, our website is a great resource, MHA Wisconsin all spelled out.org.
Yeah, and you did mention those new programs that you have, but you have a long list of programs and services that you offer to the community. There's the counseling clinic. You mentioned suicide prevention, but also veteran peer services. I know that's very important when we talk about veterans who are dealing with this way before the pandemic. There were certain things that specifically veterans deal with, like PTSD and things of that nature. But the online screening for mental health, you also kind of focus on alcohol use. And that really is something that I think has grown with this pandemic as well. People finding ways to self-medicate, to kind of just not think about everything that's taken place. And some people, while many of us are seeing the light at the end of the tunnel, some people are still in the thick of it. And there doesn't seem to be an end in place. So it's important for us to have this conversation and also just remind people that it's okay to talk about it. And you're just a phone call away. So really, just wanted to emphasize that. But as we wrap up, Mental Health America of Wisconsin, you have a number of events that are coming up. One on Thursday, May 20th, which is a mental health awareness block party. Fill us in on that.
Yeah, that's a fun event, getting people out of their houses. The weather will hopefully be wonderful. We're partnering with a couple of local Black-owned food trucks and our Great Lakes Distillery. So as we're wanting to raise awareness about mental health and have resources, we also just wanted to encourage people to come out and have a little fun and support our local businesses. Of course, there'll be social distancing and people will be required to wear masks, but we're really, really just wanting to celebrate it's spring in Milwaukee.
Yes, indeed. And like you said, fingers are always crossed in Milwaukee that the weather decides to cooperate.
So that's May 20th from 4 to 7.
Okay, May 20th, 4 to 7, and that's at 600 West Virginia, and it is free and open to the public. And is there anything else as we wrap up this segment that you'd like to share with our
viewers? I would. So on May 27th, we are encouraging the community and stakeholders to join us to talk about this crisis around the community and children and families' mental health, and come up with a solution as a community and a pathway forward. So we encourage people to join us. There's information on our website and a Zoom link. We're inviting our elected officials as well as other community stakeholders to be a part of this conversation and hopefully provide funding to support the efforts that are needed. And lastly, we have a virtual run. It's the 5-50-50. We partner with the Corker Foundation. It's a 5K in 50 days and in 50 states. And so in Wisconsin, June 12th, we will all be running outside, hopefully in our neighborhoods and our communities. If you register online, once again, you can find that on our website. All the proceeds help support local MHA and MHAs across in each of the states that they're doing the run.
Well, thank you so much for stopping by today and providing all this great information.
Oh, thank you for having me. It was a pleasure as always.
As always, Martina Gollin-Graves is the president and CEO of Mental Health of America of Wisconsin. Again, for more information, you can visit mhawisconsin.org or call 414-276-3122. When we return to Our Issues Milwaukee, we'll find out more about an organization that seeks to improve the health of babies by addressing social and economic inequities for women of color. We'll talk to a representative from Milwaukee Life Course Initiative for Healthy Families right after this.